Body Beautiful. We'll be taking your calls with questions you might have about faces, facelifts, minis, regular neck lifts, all the above. Here's the phone number, 800-440-4884. We'll also be putting the number for the doctor's office during and at the end of the segment, so be ready to jot that down. And any advice we give you today, our caveat, certainly you want a second opinion. All right. Michael from Dublin was on the line. I guess we have some shy people today. He had an insurance question.
About facelifts? Not normally. Yeah, insurance usually does not cover facelifts. Sometimes it will cover eyelid surgery if the eyelid is descending and blocking the vision, but for facelifts, no.
No. Okay. You know, there are many different brand names out there for facelifts. Does it make a difference? And there are plenty of...
I think they're all good, you know, variations on what all the stuff that you need to think about, certainly as a plastic surgeon, that I think about when I'm considering what to do for a patient. Most of them, the brand names ones like the Lifestyle Lift, the New Lift, Quick Lift, they're mini facelifts. Sometimes they'll do a few stitches deeper, but essentially they're mini facelifts. And I think the most important thing with all of those is not so much the procedure, but the doctor, and making sure you're investigating the doctor and making sure they're qualified.
Those are the questions I always get, because, you know, the people are bombarded with these, you know, infomercials about lifestyle lifts or whatever they're called, but there are so many of them out there. But so what, and that's the question everyone asks, well, why don't I get that, and what's the difference? What's the main difference?
I mean, the main difference is you've got a doctor to call when there's trouble. So if you do the procedure and something happens, you've got someone who is personally responsible for you, and like me, would be happy to answer questions, happy to take care of anything that comes up, because that's part of making sure I get a good result. I'd say the majority of the time, you know, we can do the surgery and people would recover fine without any further input. However, there's going to be a small percentage of the time when something comes up, and usually if it's something, it's small when it first comes up, and if it's addressed, it doesn't end up being something larger.
You know, I mean, clearly facelifts aren't for everyone. I mean, who is an ideal candidate, and who would you say, you know what, better not?
Sure. I mean, the ideal candidate, the things I want to see is I want to make sure I have a patient who's complaining about the things I can fix, who is realistic about what they want fixed, and who's healthy enough to have it fixed. And if all those things are together, then usually we'll get a good result and I'll have a happy patient, and that's really my goal.
We talked about this before, about kind of working your way up as you know, the aging process, the inevitable aging process. I guess it's better than the alternative, but
beats not being around. Yeah.
Right. So as you say, you try injectables, you try Botox, and at some point you say, I mean, I might need a little extra help. Do you also use those products as well with the facelift? I mean, do they ever go away, or?
Sure, no, they're complementary, and even after a facelift, we continue to age. So even after a facelift, instead of waiting 10 years to do another facelift, we may still use some fillers, use some tricks along the way to keep things looking good and fresh.
How do you, when you're choosing, I mean, you can open up the phone book, go online, there are any number of ways to find a plastic surgeon. And what are the first things you want to look for?
And the thing that I would look for, of course, is having a board-certified plastic surgeon. And an easy way to test that, or to look for that, is to see if they're a member of the American Society of Plastic Surgeons. All members have to be board-certified. Within that group, about a fourth of the board-certified plastic surgeons are also in a group called the American Society for Aesthetic Plastic Surgery, which are plastic surgeons who are board-certified and who concentrate in the aesthetic side, the cosmetic side of what we do.
All right, let's go to the phone lines. I've got Diana from San Francisco. Quick question for the doctor, Diana?
Yes.
Yeah, you're on the air.
Yes, hello.
Hi.
I can't hear her.
Oh, Diana?
I'd like to know the cost of removing the fat from under my eyes.
Oh, she wants to have the fat removed from under her eyes. Approximate price range? Thanks, Diana.
I mean, that's usually a blepharoplasty, and there's a couple ways to do that, either inside or outside, depending on how much skin is there too, because we don't want to just take the fat away and let the skin hang. If we do that, normally it can be done either as an outpatient under local anesthesia with some sedation, so I'm not bugging you, or it can be under general anesthesia if the idea of being awake is scary. The procedure itself usually runs a couple $1,000s, somewhere in that range.
Okay, and that is a very common procedure for both men and women.
Yes, always in the top 3.
All right, I guess because that kind of makes you look more awake, rested.
And it's one of the areas that kind of ages first, and it sometimes ages out of proportion. So when we fix that, it then matches the rest of the face, and everything looks good.
Great stuff. Doctor, unfortunately, we are out of time. But for more information about Dr. Mele, you can call 925-943-6353 or check out his blog, SanFranciscoPlasticSurgeryBlog.com, or visit his website at drmele.com. Thanks for joining us, and join us tomorrow at 11. We've got another edition of Body Beautiful. Have a great day, everybody. Bye-bye.
Thank you.